Are more susceptible to mutations at a younger age. They're more susceptible at a younger age. So shielding at all times, dose reduction, collimation, communication of risk benefit with parents, and you do have to get used to holding patients a lot in pediatrics. You're not going to be using Pigostat, you're going to be holding that patient down. Thus, if you work at a pediatric facility, you're going to have a dosimeter ring. Sorry, I almost put the wrong finger up there. Dosimeter ring. Dosimeter ring. A dosimeter ring. The dosimeter ring is to monitor your hand dose because you're going to be out there holding that child a lot during fluoros, during x-rays, and they want to make sure you're not getting erythema on the hands.
So it's not the wedding ring. Why would you have to wear it here? You could wear it anywhere.
We can wear it on, I would put it on my pointer finger.
Yeah, we put it anywhere.
Yeah, but my poor wife, she hates those things so much because I lost so many of them because I would forget to take them off, or I would just set them down somewhere, or put them in my pocket. So every time she would wash my scrubs, my little ring would be going on the washing machine and the dryer, and I think she had like a pile of them because I always lost them. So she like gave them to me one day. Here's all your dosimeter rings. I'm like, oh, thank you.
You put your scrubs in the dryer?
Huh?
You put your scrubs in the dryer?
I used to sometimes.
You got money?
Hmm?
Dang.
They didn't get worn out.
Yeah, they shrink.
Mine didn't.
No, I always
Mine shrink.
Mine didn't shrink.
I always felt
They
it.
shrink. I think I just got big.
I don't got money like that.
No, yeah, I'm not risking that.
No, it never shrink for me. Worked out good. Okay, so dynamic range of digital increases number and type of artifacts. Obviously, a lot of artifacts to do with kids. Probably one of the biggest one that people often forget about on kids is the logo shirts. So T-shirts with logos, that's going to show up on your digital X-rays. You won't have lots of chest X-rays with Nike and Adidas and Mickey Mouse, whatever. It's going to show up on your X-ray. Make sure they're taking that off. Make sure they take the pants off because buttons, snaps, Velcro, whatever they're using to hold their clothes together, that's all going to show up on those X-rays. So you take everything off. Underwear as well, just like with adults.
But I haven't seen baby gowns.
Baby gowns are usually pretty radiolucent overall.
But we haven't seen
But we
them
still
with
usually
the
undress the baby, just leave them in a diaper. Speaking of that, that's something I want to bring up as well. Diapers. If you're ever doing x-rays on babies, make sure that diaper is clean, especially if it's KUBs, because
Yes.
baby diapers that are wet make all kinds of artifacts. And yes, Reagan, you have to learn to change diapers in pediatrics. I know you got upset by that last time, but it's not that bad.
Yeah, but that's weird having to change somebody else's baby's diaper.
It's not that weird. It's really not.
Well, what if they pee on you?
You get used to it. Just keep your mouth closed.
That is nuts.
Well, the parents right there, can you ask them? the
Of
parent?
course, you can ask the parent, but if there's
Then
nobody,
yeah.
then you got to do it. Or please do it. Don't, that poor baby, it's going to get a diaper rash. I mean, do the baby a favor. Do the baby a favor. It's not bad to change a diaper. I can do a diaper, man. I'm considered a world record on diapers. I can do diapers super fast now. You get really quick. And they're super easy these days with the little sticky bands. Yeah. Yeah.
But you tell a coworker, like, hey, I need you to just be in here while I change this baby's diaper.
Yeah, obviously, for obvious reasons, yeah. You don't want to be accused of anything.
None of y'all.
Okay, so we're not going to go through all these. As I've told y'all, with pediatrics, everything you know about positioning is going to be flipped upside down. You have to learn to think outside the box, get very creative, and no two are ever going to be the same. A 4-year-old x-ray is going to be vastly different from a 2-year-old x-ray. A 12-year-old hand x-ray is going to be vastly different from a 1-year-old hand x-ray. You've always got to be willing to think critically to get these exams. So if you ever go to TCH, they give you a 6-month training plan, a competency-based training plan that I helped develop there with one of the managers before I left. And they basically recomp you on pediatrics because there's such a vast array and variety of ways that we do it differently from adult x-rays. So we're not going to go over all this specifically because this would be a whole class in itself, but keep in mind, when it comes to positioning, centering, everything with children, it's going to be vastly different, and it's all going to vary amongst all those different ages, 1 through 17 as well. It says most common here, but really it's even more than that. Big ones, of course, being skeletal survey, upper limbs, lower limbs, appendicular, those will be very common. Foreign bodies, all the time. Kids love to swallow stuff. Probably your most common with kids are going to be limb x-rays. They always hurt in their arms, their elbows, their knees, their ankles, especially with a very active child. Very common x-rays. A lot of fluoros too, especially on babies. Babies have a lot of fluoros, especially for kidney issues and gastrointestinal issues. Okay, some of the most common conditions and syndromes related to pediatrics: cystic fibrosis, dysplasia of the hip, NAT, that'd be your child abuse, your osteogenesis imperfecta, pathological fractures, benign and malignant neoplasms, pneumonia, that's a very common one, pneumonia. I had pneumonia twice as a child. Progeria and scoliosis, you know, a lot of scoliosis as well. Very, very fascinating surgeries to watch, by the way. Probably one of the coolest surgeries to watch, how they can repair scoliosis, even someone who has severe scoliosis. Something they definitely want to catch at a young age, because the spine is a lot more malleable at a younger age compared to an adult. In fact, as an adult, you can't really fix scoliosis that much because the bones have hardened so much. But for a child, they're still very bendy, malleable. They can shape that spine into a more straight shape and restore a lot of that quality of life to that particular child. But very cool surgeries to watch. Yes?
I don't know if you know this, but like my son, I still feel like his legs is still
A little uneven.
No, like it's like
Boards.
Oh, bowed.
and like I don't know if that's still normal. Like we asked the pediatric like before, but that time he was still young, and she's like, "There's no point of referring to
At
it right
at his
now."
age, yeah, you really can't tell yet.
Because I don't want it to be like he's older and then you can't.
I mean, as long as if they were going to catch it, they'll probably catch it when he's more. How old is he now?
He's gonna be 2 in January.
From 2 to 4, I think they're going to monitor it more. From 2 to 4, that's still plenty of time.
Because I see like when I look at his legs, I still see like it's not straight. Like
That he's bow-legged?
like it's a little
Mhm.
And I feel like that's probably why he like trips so much.
It's like,
But they'll monitor that over the next couple of years, and there's still. It's like he's not going to run out of time. So
Chris's cousin, her son is a few months older than Andrew, and his legs are like this, but his feet go inward.
so he's pigeon-toed and bow-legged.
Yeah, so when he's running, he's just like.
That's like a penguin almost.
But he's from May, so for like a year and May.
Interesting.
Like 19 months old,
Hmm.
and so he's just kind of like. But his siblings, they all have pigeon toes, so she's
Really?
thinking he sees them walking because the older kids they still walk with their toes inward. So she's like, maybe he sees them and he thinks he's supposed to do them. So she doesn't know either,
So
but
he might just be copying.
yeah,
Interesting.
because he's a little copycat. Yeah.
So to wrap this up, guys, advances in technology. Obviously, a lot of advances from MRI to ultrasound to CT to IR. CT is going to be something they generally going to avoid, mostly with kids, as much as possible because that dose is going to be extreme. One of those famous cases, by the way, that child in California, he was 2 years old. You've probably heard that story.
They got
Received
cooked.
multiple CTs because the doctor wasn't happy with the images and they were thinking there was a malfunction. I can't remember the exact number, but he got like hundreds of scans, if I'm not mistaken.
isn't it like 600?
It was hundreds, I know that, and ended up with severe burns all over the body. Those parents obviously sued for malpractice. It's one of the most famous cases of misuse of CT.
So with that, and to get so much radiation to cause severe burns like off rip, that kid's probably not going to last very long.
Well, it
into
depends
adulthood.
because if you learn, well, I don't think y'all have learned this yet, but when it comes to effects of radiation, it's very probability based.
Well, yeah, but I'm saying just in the grand scheme of things,
There's a
like,
higher likelihood, but not guaranteed.
okay,
It's just like
and
how
stochastic and
it's just like how someone who smokes for 30 years can end up having perfect lungs, and someone who never smoked their life can end up with emphysema. It's all probability based. EOS system, we've talked about that before, guys. EOS is going to be that advanced spinal system, which is a combination of CT technology and plain film X-ray technology, but it kind of takes the CT technology and puts it at a very low dose while also giving you very amazing 3D images. It's very hard to explain, but very promising technology. I talked a little bit about it last semester, but they have one of these machines at TCH. I think there's 2 or 3 in the state of Texas, TCH having one. Very, very amazing piece of equipment. The patient just stands in the middle of it. It'll give a full 3D analysis of the spine. You have a patient come in a wheelchair, it can still do the exam and give you a nice analysis of the spine. But I theorize, once again, this is where X-ray is headed because it's a very low dose exam that kind of takes the best parts of CT, combines it with regular X-ray, gives you like an overall amazing picture. So if I was gonna theorize where X-ray is going next, this is where I think it's going next, EOS systems. But it's just super expensive right now, so not likely. Now, for your image reviews for this chapter, guys, I'm not gonna go through all of these, but I'll send y'all some practice. I want y'all to learn to look closely at pediatric images, namely hands and ankles, because carpal bones are gonna vary quite a bit. I hear some of y'all crying. In fact, I'll probably go over this next, I'll go over this on Thursday, because I do wanna review this, because we're almost out of time. What time is it?
It's
48.
48.
Okay, yeah, I don't have enough time for that today, but we'll go over this again, guys, but you are gonna be expected to label some pediatric x-rays.
What are those two?
These two, you tell me, it should be very easy to identify. What's the two biggest ones?
I would say the capitate and the hamate.
Capitate and hamate, yes it
Okay.
is. Yes it is. You can see it making shape, the triangular shape right there.
Oh, that's the
There's
hamulus?
Huh?
That little fleck in the middle of the.
I don't know if that's the hamulus, but it could be.
So the carpal bones just appear out of nowhere?
Hmm?
They just appear out of nowhere?
Basically, yeah. Basically, yes. So trapezium, trapezoid, capitate, hamate. What do y'all think that is?
It's- no,
Scaphoid.
Triquetrum. Triquetrum.
Triquetrum, and we don't see the pisiform yet. Then, of course, growth plates. Everything else is pretty easy to identify. There's some tarsal bones.
So, they
That's the
did.
cuboid right there.
What do y'all think this is?
That's the cuboid?
What would be the biggest one aside from the heel?
Cuboid.
Talus.
What?
This is the talus.
Why?
This is the talus. This is a medial cuneiform. This
How
is
would-
talus. This is calcaneus. This is medial cuneiform.
Why is it like?
Why
They're-
would
they're
the
gonna
talus?
shift around as the child grows. They're gonna move around.
Oh,
So typically with the tarsals and the carpal bones, guys, the biggest ones form first, the smallest ones form last. That's one way you can remember that. Yeah.
So they're shaped the way that they are,
Oh my
like,
God.
Pretty much.
because of friction and like how we use them.
Pretty much.
So
yes.
like if somebody didn't use their legs, their carpal bones
Would
wouldn't
not fully
develop, or okay.
Absolutely. In fact, the use is what forms the tendons, the ligaments,
Mhm.
starts moving everything around into its proper space, so on and so forth. Pelvis, guys, pretty easy to identify the parts of the pelvis. Chest, common sense. We should know how to identify parts of the chest.
Is that the femoral head?
This is the femoral head. Greater trochanter, lesser we can't really see. There's your superior ramus, ischial tuberosity. What's missing though? Inferior ramus. Inferior ramus is not developed yet.
What about?
Symphysis is not sealed.
They wouldn't ask us to identify the gender of the patient on the left, right?
Unlikely.
So, because there's no way to check inlet, outlet. There's no real.
It hasn't fused yet, so you really
Yeah.
can't tell.
So what is there in the place of your bone? Cause you can see the shape of the, what.
Cartilage. It's all cartilage.
Cause like you can see the shape of what it looks like,
Mm-hmm.
but you can't see, there's no bone there, like you see like where the head of the.
Is it
femur would be,
raining?
like you can see like where it's going to form in the butt. So I know something is holding the rain.
So this is all surrounded by spongy cartilage. And as the bone grows, it absorbs the cartilage and infuses to the bone and it touches the bone.
It's raining
So then
next
it
Monday.
becomes more bone and less cartilage?
Then you
Yes.
have your capstone.
Yes, it does.
It's raining next Monday. Then you have
Yep.
your capstone.
Yeah. That's why toddlers can take so much impact. They got all that cushion. They can run into stuff.
That's why they so green.
Monday.
Andrew went to the
They
main
are.
ball yesterday,
Your last one on Monday?
and she has like a little bump right here and a
I
scratchy.
don't have to wait that long for the
And I'm like,
dates.
hell.
And
I
you
told
get-
Chris,
you
I
get
was
some
like, are
during
you
Monday
not
to
watching?
study.
He's like, dude,
There's-
I
this
was
is
And,
the,
and Tuesday
board.
morning.
It just fell.
Tuesday,
It's a little bit of that bow-legged.
Like, yeah, it's like I'm last. It's like 11ish, I think. 10:30, 11.
That's awesome.
But I have to be there early because
Little chunks, little leg chunks. Okay, guys, so to wrap up pediatrics. So pediatrics is gonna require experience and practice to obtain confidence, competence, thinking outside the box, and proficiency. And although we talked about some very negative aspects, I will say overall, The rewards are well worth the efforts. The pros definitely outweigh the cons. It's a rewarding modality, and I do call it its own modality, a rewarding modality to work in. Even though there were some rough memories, overwhelmingly there were more positive memories to be able to work with pediatrics, help children, make a difference in their lives. It's why I still to this day work with kids at my church and Sunday school. Also why I'm forming my whole dissertation around hopefully helping people who've had childhood trauma. It's a wonderful, wonderful area to work in. And if you're even a little bit interested in it, I encourage you to come talk to me next semester, as I can get you that special link to start pursuing that type of career for yourself. But we'll talk about it next semester. Any questions on pediatrics before we wrap this up? Anything else I can answer for y'all?
Not that I can think of.
Well, we'll have time next semester for that as well.